Whether you're a first-time parent or you've been through this before, there's a lot to learn about your baby's health and well-being. There's a learning curve as you start the cycle of feedings, naps, and tummy time, all while learning how your baby communicates their wants and needs. One important factor is how to tell if the baby is breathing properly, as these signals tell you that the baby is healthy and comfortable. What can affect a baby's breathing? From normal newborn congestion and sneezing to grunting in a new sleeping position, to a colicky episode, there are many things that can affect the quality and sound of your baby's breathing. Common things that can negatively affect a baby's breathing are certain respiratory illnesses, like bronchitis or a cold, croup, which is a viral infection of their windpipe, an allergic reaction, asthma, or if there's a foreign object in their airway. Understanding the signs of breathing difficulties in your baby can help you determine when a change in breathing pattern or sound is normal and when it's time to call a doctor. How can I tell if my baby is breathing properly? These 7 major signs can be signs that your baby's breathing pattern has changed. While these tips are helpful to assess an ongoing situation, this does not replace the advice of a medical professional. Please speak to a pediatrician, pediatric nurse, or other medical professionals if something seems amiss. Number 1. Healthy skin color. When your baby is first born and takes their first breaths and cries, their skin turns from a purplish color to pink. A newborn's skin should remain pink or slightly yellow from jaundice during the first week of life, with the exception of a slight blue tint to hands and feet. This is normal because your baby's blood circulation isn't quite mature yet. You might also see a blue or purple tint on the outside of your baby's lips or around their mouth when they cry, and that's completely normal too. When they stop crying, though, their lips should turn back to pink. If you see a bluish tint on their body or inside their mouth or inner lip, it may be a sign that their oxygen level is low and you should contact your pediatrician or go to an emergency room. Number 2. Normal resting heart rate. A baby's heart rate is typically much faster than an adult's. Depending on the age of your baby, their activity level at the time you measure it, if they are sleeping or crying or feverish, their heartbeat can range from 70 to 190 beats per minute. Speak with your pediatrician if you have questions about your child's heart rate. Once you have an understanding of your child's typical heart rate, significant fluctuations may occur in conjunction with changes in their breathing patterns and a reason to pay attention to their comfort of breathing. If any concerns, contact your pediatrician. To take your infant's pulse, lay your baby down with their arm bent so their hand is by their ear. Then, feel for their pulse over their heart or between their elbow and shoulder. Gently press 2 fingers where you feel a heartbeat for 15 seconds. Count every time you feel a beat for those 15 seconds. Then, multiply those beats by 4 to get your baby's heart rate per minute. Number 3. No retractions. Retractions are when the area between a baby's ribs and neck sinks in or appears to be pulling in when they breathe. This is one of the most important signs to look for if you suspect your baby has breathing issues. Retractions are common when babies are working harder to fill their lungs with air. If you see that your child has retractions, sit them upright in a comfortable position and call your pediatrician. Number 4. Look at their nose and mouth. Babies breathe exclusively through their nose until 4 months of age. While breathing may sound snorty if an infant or child is congested, there should not be any significant flaring of your baby's nostrils if they're breathing comfortably. If you observe flaring nostrils, your baby may be working harder to breathe, and you should contact your pediatrician or be seen in an emergency room. Number 5. There are no noises. Your baby's normal breathing is either quiet or sometimes a bit snorty from typical infant congestion. If breathing is more difficult than usual, you may hear them make some unusual noises. Some of these noises include wheezing. This faint whistling-like sound is typically heard when exhaling and is often only heard by a stethoscope. Depending on the child's age, it could be a sign of bronchiolitis, asthma, or reactive airway disease. Wheezing is a sign of small airway constriction. Stridor. This high-pitched sound, typically heard on inhalation, can be a sign of upper airway inflammation. Stertor. This sound resembles snoring and is typically associated with a cold or congestion. Number 6. No significant change in posture. Similar to an adult, older infants will try to change their posture to improve their breathing if they are having difficulty. For example, they might lean forward or tilt their head up. If their head and neck position seems different than normal, look for other signs of increased work of breathing to ensure the position isn't a concern. Tips for monitoring your baby's breathing. Monitoring is among the best steps you can take to get an idea of what normal breathing looks like for your baby. These 3 tips can help you learn what's the normal and better spot when something may be amiss. Get a baseline for what's normal for your baby. While you may initially be concerned when you observe a change in breathing patterns, keep in mind that some of these changes may be perfectly normal. Some babies may occasionally breathe with their mouth slightly open, be chronically congested, or have a heart rate that is faster than their peers. If that's the norm for your baby, then that can help you rule out breathing issues. Use Breathing Wear to learn your child's typical patterns. Breathing Wear covers a category of specialized wearable tech that can help track your baby's normal breathing. These soft pieces, typically placed on a baby's foot or gently wrapped around their body, can help parents get peace of mind through the tracked insights. This helps set a baseline for what's normal for your child, and you can use these data to compare any changes when you're not sure if their breathing is affected. Nanet's Breathing Wear line grows with your child from the newborn stage to 24 months. Available in swaddles, sleeping bags, and wrap models, Breathing Wear pairs with Nanet Pro camera's computer vision technology to detect and monitor your child's breathing. The sensor-free, radar-free Breathing Wear is machine washable and dryer safe. The accompanying app tracks your baby's breaths per minute and sends your real-time alerts on the app if anything veers from the norm. For more information, check out the link in the description. Understand your child's mood changes. Knowing what keeps your baby happy and what makes them not so happy can help rule out whether a breathing issue is in the mix. If they're typically cranky around 4 p.m. or take a while to wake up after a nap, you can safely attribute that to their typical temperament. But once things begin deviating from the norm, that's when you may want to check for other signs of wellness. The bottom line. As you get to learn your baby's temperament, habits, and preferences, take a closer look at their typical breathing patterns. Knowing what's normal for your baby and what's atypical for all babies can help you monitor your baby's health with confidence. And with added assurance from helpful baby wear like Nanet's, you can rest easy knowing what's expected and when you need to call the doctor.